Hello there, I'm Tina and I live in Katherine, which is 300 kilometers south of Darwin. It is the fourth largest town in Northern Territory and has a total population of 9,187 people, of which about 25.5% of the population is Indigenous community. According to the Australian Standard Geography Classification, remoteness area and area system, it is classified as a category 4, which is remote, and it has very restricted accessibility of goods, services and opportunities for social interaction. Life expectancy in rural area is generally 76.5 years old for male and 81.8 for females, which are lower compared to life expectancy of Australia. The temperature in Katherine varies from 20 to 34 degrees Celsius annually, and the mean rainfall is approximately 973 millimeters, which makes it a humid area. In the wet season, that is from November to April, we generally see massive thunderstorms and heavy downpours, causing floods and subsequently accessibility restrictions. The main industry of employment in Katherine includes administrative and support services, healthcare and social assistance, and education and training. About 70% of the community goes to work by car, 8% walk, and about 4% travels by bike. The median weekly household income is $1,534, which is about $200 lower compared to the Northern Territory. Only 36.8% of people aged 15 years and over finished year 12, and only 51.5% reached year 10. Social issues often seen in Aboriginal community includes lack of medical and disability services, little education, high unemployment rate, ineffective government programs, abuse and neglect, and high levels of alcohol consumption. Services available in Katherine includes immunization clinics, school medical screening, community education, health promotion units, health promoting school nurse, 3 aged care facilities, Katherine District Hospital, 1 dental clinic, and a nutrition outpatient clinic. Healthcare or pension card holders have access to general dental services, and an orthodontist usually visits the dental clinic every 6 weeks. On the other hand, preschool, primary school, and high school students have access to school clinics. There is only 1 dentist in Katherine, so you would expect a long waiting list in the clinic. Statistics also show that there is a lower proportion of children receiving dental services in Katherine. Now I'm going to talk to my mom about the programs in the community.
Can you introduce yourself? Yes, so my name is Trisha. I'm the mother of 2 beautiful children.
What has the dentist done in our community since she first came here?
Okay, so our dentist's name is Dr. Stevia, and she's just been so great. She's been here for around 3 years now, so she's meant to be here for 5 overall. And at the beginning of her program, she just went in and went to see the people in the primary school, the high school, and the mothers groups. So she talked to your principal and the principal of the high school. She also talked to the PNC and the president of the Mums and Bubs Club as well. And they've told her exactly, what they want changed for their kids, what the main problems are, and what will work for them.
Okay, that's great.
So she's also got this program called Lift the Lip in the community. So what it is do you remember when I used to just lift your lips all the time and just took a look? It's because the dentist taught us about this thing, so the white streaks on your teeth, that's the early stuff. And the caramel coloured brown stuff is the more advanced stuff that she's got. That's the advanced sign of decay. And what she's done is to help heal those rotten teeth. She's put fluoride varnish on, trained nurses and the Aboriginal health workers to do it too. So a lot of people in the community are getting that done.
Okay.
And she's also put fissure seals in people's teeth.
Has she done anything special for the school?
Yeah, because she worked with the parents and teachers to make a program. She did that thing about the lunch box. You look at what's good and bad for your teeth. And also at morning tea break, she gets you to have a cup of water and with a celery stick or a piece of apple. Your canteen is really healthy too, so they don't sell any more sugary stuff. And I also remember that she taught you how to brush your teeth.
Yeah.
Because the dentist went in and taught her how to do it.
Is there anything special for the mom and the baby?
So she's worked with the president of the Mums and Bubs program, who's my best friend Tammy, and she's told her, that we get swollen gums when we're pregnant. We also don't really know what's the best foods to eat for our baby's teeth, and we don't really know when we should be brushing their teeth and those types of things. So she told me I just need to be brushing all throughout the pregnancy, and she also said that I need to be having lots of calcium, so milk, salmon, almonds, just to make sure that your brother or sister's teeth are really nice and strong when they come out of here. And when your little brother or sister gets the first tooth, be brushing their teeth without toothpaste till they're 17 months. And then when they get to a toddler stage, you brush their teeth with special kids toothpaste because it's got low fluoride, better for them. Yeah, and also no more fruit. Remember I used to give you fruit juice in a sippy cup before bed? It was really nice, but you can't do that anymore.
Anything done for teenagers like Tommy?
Yeah. So for your older brother Tommy, I haven't neglected them. So they get up to no good though, getting piercing, smoking, drinking. So Dr. Stevie's cleaned up the place and she's just popped posters all around shops and places where they hang out. So there's ones about how smoking can cause cancer and cause your teeth to fall out from that periodontal disease. And the other one about how drinking alcohol can cause your teeth to rot. And with the mouth piercings, you get infections from them. I don't have time to actually see the dentist, so my teeth have been before, Dr. Stevie's got a big bag. So she's got and works with the childcare preschool service thing, and she's got this child minding service. So that means that, you guys can get taken care of, and then I can go see the dentist, which has really been helpful.
Okay. What about those families whose kids don't go to school in town?
Well, yeah. So she's worked with the School of the Air in Katherine, and she's got the teachers to implement the oral health stuff in their curriculum. So they also get information as well. So it's really good.
That's awesome. But how does she know what's best for the community?
Well, yeah, so the best thing about Dr. Stevia, she's worked with people, everyone in Katherine, all along the way. So because there's all these different groups in our community, so mums and kids of different ages with different needs and stuff. So, she talked with us and asked us what we really need. So she has an understanding of that. And she's also looked at how the program is working with the people she's developed it with, like teachers and the mothers and parents and stuff. And she makes changes from what they've told them, like what do we need to change when it's been done. So she's been really good.
Okay. Okay, thank you, Mom. I'll see you later.
Okay, dear.
Oh, hey, Grandma. Oh, hey, Tina. Oh, my beautiful granddaughter. I haven't seen you for ages. You grew up so much since last time I see you, hey? Oh, so why have you come to see me today?
Well, Grandma, we're filming a documentary on the oral health promotion program that has been implemented in Katherine, and I want to ask you how things has changed since you were young.
Oh, okay then. Well, it all started when I was 44, and the year was 1972, and my hair was long and black, and my teeth were white, and I just had your mother too. That was also the year they put fluoride in Katherine's water. They did that because so many people were walking around with holes in their teeth. You see, my dear, they told us that fluoride combines with your teeth and strengthens them. When acid hits them, they won't decay as fast.
I know, Mrs. Terry already told us that at school.
Oh, okay, dear. So where was I? The fluoride did make things a little better, but we all still had more holes than city people. I think it all comes down to the way we ate. The shop didn't have the healthiest food because it was so expensive sending stuff here. So we've been eating sugary things all our lives. There's an easier access to sugar than it is to clear water. This leads to high caries rate in the community of Katherine. The overall DMFT in Katherine as in 2011 is 5.5. This means that on average, a person living in Katherine has about 5.5 decayed, missing or filled teeth. There is an urgent need for more specific programs and policies to target disadvantaged subpopulation as there are high risks of DMFT in Katherine.
But they've changed that now, haven't they?
Yes, they have, my dear. The dentist talked to the owners of all supermarkets in town and they've agreed to buy fresh food together in bulk. So it is cheaper for us and cheaper for them to get it sent to Katherine.
That sounds good, Grandma.
Oh yeah, I really love that. I can eat food now, and that's good for my teeth instead of rolling them away.
Has the dentist given you any special advice?
Yes. You see, your grandma take pills. So, a blue one, a yellow one, and a purple one, and there's some other pink ones in there. So about 5 pills, and they make your grandma's mouth really dry.
Yeah, I remember. Your mouth used to smell pretty bad too.
Oh, really? Well, it doesn't now. It's all because the dentist said I need to drink more water. I drink about 2 liters every day, and I use a saliva substitute. Dr. Stavia also told me to take my dentures out at night so they don't grow fungus.
Ew, fungus!
Now my denture is so beautiful. Look, dear.
Oh wow, it's so pretty now. So what else has the dentist done?
Well, I can't drive anymore. It's too hard to see. Everyone gets mad on me on road, so I haven't been able to drive to the dentist at hospital. Now Dr. Stavia visits the nursing home I live in. So every 2 months, she brings her portable dental unit that looks very heavy and check up all our teeth.
Wow, so she comes to you.
That's right, dear. Oh, and what's really good is that she taught the carer how to brush their residual teeth. So from what I've seen, she's asked them to put the tennis balls and bicycle handles on the toothbrush so people can hold them better. She's also asked some of us to use electric toothbrush because it's easier and if you have a stroke.
A tennis ball and a toothbrush?
Yes, dear. She has taught carers how to brush the teeth of people who cannot do it themselves. The carer puts the toothbrush in boiling water and bends the hands back so it can reach all the surfaces. Everyone's teeth get brushed twice a day with fluoride toothpaste.
She's done such a good job helping everyone now.
Yes, she certainly has.
Well, Grandma, I've got to go to the bus stop because I have to see the dentist later on.
Oh, can you pick up my friend too? He needs to go to the bus stop.
Yeah, sure thing, Grandma. See ya.
Thanks, Tina, for taking me to the bus stop. Getting places in Katherine can be really hard in a wheelchair.
No problems. I was just going to the bus stop anyway. I'll be going to the dentist later on.
Oh, you mean Dr. Stevia? I saw her the other day. I hadn't been able to go to the dentist since my legs got crushed, but since Dr. Stevia's clinic made some great changes and the trip to the dentist has been a really easy experience for me.
What do you mean? What trouble were you having at the dentist before?
Well, they used to have stairs to get through the waiting room, and all the doorways were too narrow for my wheelchair to fit through. When I used to try and go, I had to have people carrying up the stairs. And then when I finally got into the clinic, the setup prevented any kind of easy access for my chair, and I was just knocking things over everywhere in there. And after that first go, I was too embarrassed and decided I wasn't going to go back.
Oh, that sounds awful. Your oral health must have been really, really bad. And neglected as well.
Yeah, they got real bad. I started not wanting to go outside and socialise, you know. But Dr. Stevia, she fixed all that, you know.
Yeah, that's great.
There's now a ramp to go inside, and all the walkways are much wider so my chair fits, you know. And it's made everything so much easier. I don't feel marginalised no more. I think it even made they even made people working there at the dental clinic undergo some sort of training so they're able to, you know, better understand where disabled people like I am coming from.
Yeah, I'm so glad things are easier for you right now. Well, I'll leave you here.
Yeah, thanks for
And-
talking to me.
No worries. I'll
Okay.
see you next time.
Yeah, goodbye.
Bye. Oh, hey, Mark. Haven't seen you in ages. How have you been?
Good. What have you been up to, Tina?
I've been filming an oral health promotion program. Do you mind if I interview you right now?
Yeah, sure. What's it about?
Oh, it's just about a program that Dr. Steven has implemented recently. I've heard that the Indigenous community here in Katherine have poor oral health. Is that true?
Unfortunately, that's true. As you know, I'm an Aboriginal community health worker, and as part of my job, I provide immunizations, screenings, patient assessments, and community health educations, as well as other preventative services right here in Katherine. And as you know, we don't have a large number of health professionals available here, and so most Indigenous patients see me first for medical advice. and I can tell you that tooth decay has been an ongoing problem here in Catherine. So when I first started working here, I noticed how many patients see me for dental-related problems, particularly toothaches. And before it was quite frustrating because there were no dentists nearby to help them. Patients would actually have to travel long distances, often over poor roads, before they can actually get to the nearest dentist. But fortunately, with the arrival of Dr. Stevia, all of this has improved.
So what has Dr. Stevia done to help the Indigenous community?
So when Dr. Stevia first arrived here in Catherine, one of the first things that she did was that she formed a focus group. Included in the group were members of the Indigenous community, including Aboriginal elders, Aboriginal health workers like me, and also health promotion officers. From the community consultation, Dr. Stevia found out about the increasing numbers of Indigenous people experiencing toothaches due to caries, as well as the problem that we have here, which is the lack of oral health services and oral health staff available to cater these patients. Since then, we have been working together with the Indigenous community to implement programs to address these problems.
So what has been done to address these problems?
Well, one of the newer programs that Dr. Stevia have implemented is the fluoride varnish program. So under this program, children's teeth were applied with fluoride varnish in order to prevent caries. Aboriginal health workers like me were also trained to apply varnish, which I thought was a good idea as this allowed us to reach more Aboriginal children within the community. Also, Dr. Stevia also trained some of the community health workers, including me and some community health nurses, here in Catherine to screen and detect for early signs of decay in children. In addition to these programs, Dr. Stevia have also been conducting regular community information meetings with the members of the Indigenous community. In these meetings, Dr. Stevia provided oral health education as well as talk about the importance of oral health as well as how we can improve our oral health.
How have you contributed to the implementation of these programs?
A central part of my job has been to communicate and liaise with the Indigenous community and Dr. Stevia in planning, developing, and implementing these programs. Also, as you know, many Aboriginal people do not speak English as their first language, and so as part of my job, I can also act as an interpreter. As a matter of fact, there are about 32 Aboriginal language groups here in Catherine alone. So as you can see, this can cause a lot of difficulties in delivering services and programs. Not only that, but there are also cultural barriers between Indigenous patients and non-Indigenous health workers like Dr. Stevia. And so as part of my job, I also work with her to assist her in delivering services that are culturally appropriate to the Indigenous people here in Catherine.
How does Dr. Stevia know that her programs are working?
As you know, Dr. Stevia regularly holds meetings with a member of the Indigenous community. From these meetings, Dr. Stevia uses the feedback from the community to gauge whether her programs have been working effectively. In addition to that, she also uses the feedback to further strengthen and improve existing programs. I am quite proud to let you know that since the implementation of the fluoride varnish program here in Catherine, we have seen a greater reduction in the number of children who experiences decay.
It's nice to hear that the Indigenous community have been actively engaging in these programs. Thank you for your help today,
Thank you.
Mark. Bus is coming, let's go. Hi, Dr. Stevia.
Hi Tina, how are you going today?
Yeah, pretty good, but this is my first time coming to the clinic, so I'm a bit nervous today.
Don't worry, nothing to be worried about. Do you know anything about going to the dentist?
Well, I've talked to a lot of people in the community today to try to figure out what to expect. Everyone had something on the oral health program that you have started here and how that had affected them. How did you get all these dental information out into the community? I wouldn't have known to come if it's not for that time you visited the school to show us how to brush our teeth.
Well Tina, we did a few things. So yes, we did visit your school, but we also did other things like, have you noticed all the posters around town? For instance, the ones that tell you what causes decay, or that you shouldn't rinse your mouth out with water after brushing your teeth. Or maybe you've seen the ones on gum disease?
Yeah, I did notice some of those around the supermarket and parks. They're really good. Not many words on them though.
So you did notice that they were quite diagrammatic. Yeah, I know that's confusing, but we have done that on purpose so that a lot of people from a lot of different cultures or a lot of different age groups can understand it. We didn't want some people to miss out on the information just because they have troubles reading English.
Oh yeah, that makes sense then. I suppose Catherine does have a white cultural background. Have you had to do anything else different in Catherine to what you would normally do because of the different cultures?
Yes, well we found that in many communities, healthcare workers haven't had a good understanding of what is culturally appropriate in Aboriginal communities, and this has prevented a lot of Aboriginal people accessing health services. as in Katherine we have a large population of Aboriginals, it was a large concern for us. To help with combat with this, my team and I, we've all undergone some training with cultural awareness programs, and we've now extended our professional relationships with our Aboriginal healthcare workers. So that's going really well.
So what else have you done to get the general population thinking about their oral health?
Well, we've increased TV and radio advertisements, as in 2006 about 92% of Aboriginal remote communities received radio broadcasts and about 95% received television broadcasts. So this was a really good way that we could reach a large population and get the message over really effectively.
Oh yeah, I saw on one of those ads that we should use fluoride toothpaste and drink the town water because fluoride is good for the teeth.
Yes, those ads on fluoride were really good at making the community aware of why it's a good thing that we have fluoride in our water, and it shows that we are continuously supporting water fluoridation. It's important that we do this because some communities in Australia have gotten the water fluoridation removed, and that's simply because they just didn't understand the benefits and the risks of fluoride. It's really important that we, as dentists and other professional people, we try and support our healthy public policies.
Yeah, it is really hard to know what is good for you with so many mixed messages around the place.
Exactly, so that's also something we're really careful on in designing our program. We wanted to make sure that the messages coming to the community weren't contradicting in any way. We wanted to make sure that what we see from the government basis was also what we'd see on a small in the community basis, which just helps the community understand what's actually needed and what's best for them.
Have you found that there has been any limitation with your program?
Yeah, there's some things about our program that do limit the progression. For instance, with us focusing on the elderly population, our strategies rely on the elderly having professional care or assistance of some kind. This isn't always the case, especially in some communities. Their adults are often cared for by their children. Another problem that we also have to deal with is that many of our approaches involve the education of the children, but some kids don't actually attend school, so that's why we had to go into some of the wider based education system.
Well, I think you have done a great job listening to us as a community.
Thanks, Gina. Well, let's get down to business. Do you mind if I take a look in your mouth now?
Yeah, sure.
Excellent.
So we have talked to the Katherine community, and it seems like Katherine is doing a good job at their oral health programs. These programs must be continually evaluated and improved depending on the changing needs of the community to ensure that people in Katherine receive the best quality of care that they need.